physicians.
If you can hear me, it means you've made it to the New Year 2020. I welcome you to this glorious year. And I welcome you to the maiden edition of our program, your program, The Physicians. My name is Dr. Martina Agbero.
Dr. Memuna Yusuf Kadiri, Happy New Year and welcome to the new decade. We, the physicians, we are going to take you all around your health from the preventive, of course, bringing in experts to talk about some treatment modalities. So the physicians is actually designed for the entire family because we care about your health and because your health is a human right issue. And for this singular reason, the physicians have come to stay.
You've been talking a lot about the crisis we have in the country with the doctor-patient ratio. So how did we get here?
We got here because of who we have developed into. Very selfish people, very unpatriotic people. Except we put nation first before self, we ain't going anywhere. Over a period of time, there was infrastructural decay and nobody cared. Over a period of time, there was economic downturn and nobody cares. It is a multifactorial thing, but the major reason why we are here is greed and corruption. Corruption, not only corruption in the cloth of the nation, but every fiber of the fabric of this nation.
Just joining us here onto The Physicians, we actually have been discussing those who actually need the services of a psychiatrist or a therapist. And Dr. Bonjibola actually have been doing justice. And I just told her it looks like everyone actually needs the services of a psychiatrist.
In sub-Saharan Africa, Nigeria has the highest number of people with diabetes, with an estimated 3.9 million people. As we might already know, diabetes is a metabolic disease that causes high blood sugar. This damages organs and tissues throughout your body. The higher your blood sugar is, and the longer you live with it, the greater your risk for complications.
One of the reasons why I actually studied the course medicine, why I'm a medical doctor today. Growing up, I lost a sibling, and I actually saw her at our inter-house sport when I was in secondary school on a Friday. By Monday, they came and picked me from the school. I got home, and lo and behold, she was gone. What happened? They said it was malaria. Why? They said she had this fever and all those things. They gave her medication. They went to hospital. And the sad thing is, she had anemia. She became anemic because of the malaria that she had. So she, it was so
Preventable death.
Yes, and the most painful thing was they needed to transfuse her, but the doctor was not around. The doctor was not available to sign. So my daddy kept driving around town looking for the doctor to come and sign. And the nurse said they can't do anything unless the doctor gives that instruction.
Failure of the health system.
Then my sister died. So and I was asking, what happened? So with that reason, I said, okay, I need to know. I want to see her own and my other brother who also passed on with jaundice. I said, why are they all dying like this? So I said, okay, when I'm a doctor, I will be able to know why they died. And the most painful aspect is that it affects children.
That's true.
Yeah, we have children. Children also have diabetes, apart from adults having diabetes. And one thing is, have you ever had anyone, a close relative with diabetes before?
Yeah, there's history of diabetes in some of my friends I do know. My family know, because as it's mainly another medical condition, but diabetes, I had a friend whose mom, dad, two of her siblings.
Well, don't even go too far.
Yeah.
In my own family, my dad was diabetic, and he managed it for over 30. For something
that is the thing a lot of people need to know too.
And you know
managing it.
You have to keep fit. You have to keep active. It's a little bit counterintuitive because when people have back pain, they want to rest. They think that what they need to do is to rest. Rest has actually been shown to be not a very good thing. And when I say rest, I mean just not do anything. Yeah, if it's very painful, you can sit down for like 20 minutes to get over the pain, but keep moving. Movement is life. Movement is life. Keep moving, keep getting fit, keep exercising, keep walking. Obviously, you shouldn't do the high-impact exercises, but keep moving. And I suspect that with the way the world is changing, where people are working more from home, we might start having more issues of people presenting with back pain because they're not getting about as much and not walking around as much. So definitely a sedentary lifestyle does not support so much the prevention of back pain. And then the third question, what are the causes? It's a very difficult question to answer because if you have 100 people and you investigate those 100 people for back pain, so 100 people come in here with back pain and you investigate them for back pain, you might not find more than 15% of an actual cause that you can say this is the reason why this person is having back pain.
When your pressure is high, that you have glaucoma, because some individual will go to eye clinics, they just tell them, check my pressure is normal, I'm fine. No. The eye has to be examined because sometimes it may be due to other things. Maybe there isn't enough blood flow to your eyes, especially if you suffer from other diseases like hypertension, diabetes. All those things may actually cause problem with blood flow, and it may result into glaucoma. And then the last one, of course, is age. We all are praying to grow old, and we have aging now. People are growing older now to 80, 90, 100. So it means we're going to have a big burden of glaucoma. So that's why we are here, to let people know that you need to go and get your eyes tested to rule out glaucoma. You may not know. By the time you know it, it's usually far gone. So
welcome back. If you're just joining us, you're on to your regular program, The Physicians, where your health is our business. Today we'll be talking about albinism. Albinism. So oftentimes people call it different names, but then we have in our studio a renowned dermatologist, one that has always been with us and a regular face on our program, The Physicians. She's no other person than Dr. Folakemi Cole Adefe.
And then the thing about albinism is, like we said, a lot of people with albinism, they are perfectly normal.
Yeah.
It's just the color. They just and that can be managed very well. Most people with albinism are very beautiful and desirable if well cared for. Once they just know how to take care of their skin, of their eyes, I mean, they are good to go.
Talking about your hands, your upper limb or your lower limb, so legs, thigh, arm, forearms. That guideline was developed for that because of a particular malignant condition called sarcomas, which are just cancers of the connective tissues of the body. But that also applies to trunk, because some of those cancers can occur on the trunk, which is your back or the front of your lumps in places like Texas can be benign or malignant. What is important is that any lump around there should be properly examined. So size doesn't really matter too much around the testes. What you should do, number one, is what I've described earlier, clinical examination by somebody qualified, usually a urologist. That's what the specialists who look after that area are, the urologists. And if you find someone who's got experience, who wants to examine you well, subject the testes to appropriate scan, whether it's an ultrasound scan or other complex scans like prescribed MRI scan, and then tell you whether this requires a biopsy or not to make that diagnosis.
What tends to be a problem is the physical appearance, especially for girls. So the cosmetic appearance of it is what tends to be an issue in the main. And so you then have to define scoliosis in terms of severity. You look at the mild, look at the moderate, you look at the severe. And you say, okay, what is mild scoliosis? Do I need to do anything about mild scoliosis? Absolutely not. Do I need to do anything about moderate scoliosis? Maybe, but it depends. Do I need to do anything about severe scoliosis? Almost certainly yes. Because if you have severe scoliosis, then what can happen is, over time, it can affect the lungs, affect the way the lungs function, because if you imagine you being twisted and you being curved to one side, that reduces your lung volume. But that's a severe case.
To be careful when it comes to health. When it comes to health, you just need to be careful, learn from best practices, and just don't dabble into treatment or management. Look at what works in other places, and then you can replicate it in your client.
So let me ask you this. Is it every time that you are bitten by mosquitoes that you have malaria?
It's not every time.
It's every time.
It's not every time.
So,
like we said, we have some immunity.
Yes.
You can be bitten, the parasite may be in your body, but if you have the immunity, you may not come down with malaria.
So, two-pronged kind of question. Why did they stop the Sunday medicine, the Daraprim? The second part is the fact that how potent our local helps in managing malaria. If I will play the devil's advocate again in the sense that is it that we are not exploring that in malaria treatment? Because when you look at this current treatment now, you trace it back to the back of a tree. It's tree roots are not. Because what people are carrying, we have people carrying jadi, or they will have malaria, pluck dogoyaro trees, boil it, the native way.
Even with COVID, they ask people to drink it.
Yeah.
Yes. With COVID, they ask you dogoyaro tree, pawpaw leaf, cover yourself, enjoy the steam, you'll be fine, and drink it. People they came and gave testimonies that they were fine with that. So let's talk about it, because these are the basic things our viewers truly need to hear, and those are the things that will help them to know. This malaria thing, though it is very common, people recover, but it can be deadly.
In our area, we know them to be Bonzota. We don't believe that they are doctors, but because they are doing it, we refer to them as doctors. So people prefer to go to them because they are easy to approach, and people knows them around. So whenever an accident happens, they refer you to that place rather than going to the hospital. So people prefer to go to so person. Like in my time, there's a man that is known for it. If there's anything about bone, they refer you to the man, and it's easy to approach. The children that they are doing it in no personal, so it is easy for people to say, "Excuse me, sir, this is what happened to me. We welcome you and start treating you straight."
Well, to mothers especially, while they are pregnant, they have to take their health seriously. They have to consider the babies they are carrying in the womb, take the adequate medical drugs, and they also need to visit the antenatal when necessary. They also need to reduce their stress life, make sure the basic stress of the day is reduced, and they also need to rest a lot.
We're talking about the lessons from the pandemic. It's something that is very, very, very close to my heart. At least now that the restrictions have been brought down. In the past, we had a lot of mask here, social distance, wash this and do that. Now, at least we have a breather. They have said we can actually now relax a bit. But that does not mean we should throw caution to the wind. So let's hear from you as a consultant public health physician. Just give us a general overview first about the pandemic and before we now go into the lessons that are learned.
Thank you very much, Dr. Martina. So as we all know, sometime towards the end of 2019, the world was, caught up in a very complicated, perplexing, and life-changing time when the COVID-19 pandemic that started somewhere in China spread to the rest of the world. It took the world a little bit by surprise, especially because nothing about that pandemic was what we had known before. Everything was new. And as with anything that is new, it took us a while to understand what was happening and how to adjust to it. But with time, you'd observe that people started to, with new knowledge and more evidence available, we started learning how to cope with it. So this pandemic spread across the world. And that's what characterizes a pandemic. When there's a health, incident or a disease or a situation that crosses one country into another, crosses continents. So that's what characterizes a pandemic. And it happens in a measure that is completely unusual and affects people across this continent.
There are many different eye conditions and diseases that can affect a child's vision. Eye problems in babies may be congenital, usually genetic or through intrauterine insult.
Now, it's important that we ensure that children's eyes are kept well. How do you keep them well? Make sure that you clean the eyes. Mothers, like newborn babies, sometimes they have some discharge occasionally, probably because of the descent through the mother's vagina. During that time, they may have some infection. So for such children, just getting clean water and clean cotton wool to clean it off is adequate.
Stage 4 cancer is sometimes referred to as metastatic cancer because it often means the cancer has spread from its origin to distant parts of the body. This stage may be diagnosed years after the initial cancer diagnosis and or after the primary cancer has been treated or removed. Stage 4 cancer is the most advanced stage of cancer. It is diagnosed when cancer cells spread or metastasize to other parts of the body away from the original tumor site. As such, stage 4 cancer is also called metastatic cancer. Although some people with stage 4 cancer can live for years, the prognosis often isn't good. Therefore, the goal of treatment is not to cure the cancer, but to slow or stop its growth, relieve symptoms, and extend survival time. Our guest today is a stage 4 cancer survivor. I'm sure you want to hear the experience.
A lot of it is the mental battle. So
Sure.
yes, I had to try as best as I could. I mean, to be strong. There were some moments of weakness, definitely. There were some that I just did not understand, like, why is this happening to me? I tried to at least live a healthy lifestyle. I mean, I don't always succeed, but I do try. And why is this befalling me? It was very, very confusing. And yeah, the toll the cancer was taking on me, the toll the treatments were taking on me, it wasn't easy. So yeah, I mean, it was thanks to different things. When somebody will ask, how did you get through it? It's really different things. I mean, there's, first of all, I mean, God's goodness is...
This is what we try to teach people and try to understand how it affects you as an adult. You try to learn the pattern, and for the parents, try to know where because a lot of parents have some of our beneficiaries. They have parents have 2-3 children, who live with sickle cell, and they come to us. So and sometimes you hear things like, this one is not always falling sick, but this one is always falling sick, or things like that. So we try to teach them that they are different. So something triggers this person's crisis more often than this person. So you have to try and understand that so that you know what to do. So another thing is when it comes to stress management too, we try to let them know that one child living with sickle cell can decide to sweep the whole of this room and not nothing will happen. They won't be breathless or anything and still go ahead and play for the day. Another child could just sweep half of this room, is out of breath, and can't just manage it. So don't compare. Even though they live with the same disease, try not to compare. They are two different people. They experience it in different ways.
And to just out there, I'm sure you've heard it all from our guest here, Maureen Wachi. She is a sickle cell warrior, and she's doing very well. She's told us a whole lot about the symptoms and her own experiences. So I'm sure we can actually support them in whatever ways that we can. And of course, our colleagues out there, even for parents, when the child is having crisis, we all know what to do. You support. If not even your child, a neighbor's child that has crisis, you can actually support. Just lend the love that the child requires. And when the child says, I have pains, I'm going through this, listen. Don't say, I've just given you paracetamol or an analgesic, you don't need it anymore. Ensure you take that child to the hospital, to the professional. They can actually live long. When your thyroid makes either too much or too little of these important hormones, it's called a thyroid disease. Thyroid disease, therefore, is a general term for a medical condition that keeps your thyroid from making the right amount of hormones. Your thyroid typically makes hormones that keep your body functioning normally. What is the thyroid? What does it do? Who is affected by thyroid disease? What are the possible causes? Today, on your favorite TV health talk show, The Physicians, we shall be discussing thyroid disease.
In this form, you have fibrosis of the thyroid gland, and all this, and some surrounding organs, even to the mediastinum, there's fibrosis.
When you say fibrosis, for the purpose of our viewers out there, what does it? Is it like a sponge or something?
How will I do it? I'm trying to use the layman's term
right
now. When I say fibrous tissue, it becomes
like a bit brittle,
thickened,
okay,
non-functional,
okay,
okay. It's like it's just
there.
Okay, you understand? And so not producing enough thyroid hormone.
Okay.
And even other surrounding organs. You know, the parathyroid hormone lies just behind the thyroid gland.
Okay.
That one also gets fibrosed.
Wow.
So the patient now has
functional
hypoparathyroidism alongside with it, with some other organs. So that's another cause of hypothyroidism. Are you getting what I'm trying to say? So you
business. So today we're talking about obstructive sleep apnea. Obstructive, it sounds very big, obstructive, apart from the sleep apnea. To the common man, how would they know there's something called, if they are going through an obstructive
For the common man, it just simply, for them to understand, it means something that obstructs your sleep.
Yeah. So, but like, is it for people like, if you snore?
No, because snoring is actually, it's not part of it, but it's actually a symptom.
Yeah, that's like for a common man.
For the common man, sleep apnea is when it's an obstruction. Normally you sleep well. There's something like an obstruction. The obstruction in this case is that you stop breathing temporarily.
With acute urticaria, there's not much difference between males and females. However, with the chronic type, it's more common in females because of autoimmune conditions. So people who have some autoimmune disorders can tend to have urticaria, more chronic urticaria. Like for some people, things like systemic lupus
erythematosus.
Yes, systemic lupus erythematosus can present with urticaria at the early stages. And autoimmune conditions are known to be more common in women. So with the chronic urticaria, you may have more of women than men. But in the acute type, which is not too long lasting, then there's no difference between males and females.
So in understanding health insurance, are there basics?
Yes.
Are there basics of health insurance? So if yes, can you please pull us through?
Yeah, in understanding health insurance, one has to know the basics of health insurance. There are several, plans, but they're similar. You have some called gold, bronze, silver, gold, platinum, diamond. Most of the time, the higher plans pays for amenity. Imagine you say you want to go to the hospital, want to stay in a single room. You want a television there, you want a fridge there, you want newspapers there. Yeah, diamond, platinum. These are cosmetics, so to say, but we need them. Now, almost all the plans are comprehensive. Outpatient is treated, inpatient is treated, surgery to extent. Now, you have to look at what any plan covers and the amount of money for that particular plan and the hospitals. Okay. There are some hospitals that we call boutique hospitals. Okay. The people I talk to, they know. Maybe, they know. There are some hospitals we call boutique hospitals. So those boutique hospitals are associated with very high plans. So once you look at a health insurance plan, you will know the one that fits you and also fits your pocket. Okay. Because healthcare is comprehensive on all the plans. Okay. And I'm going to use the same drug to treat you.
So it doesn't reduce the quality.
It does not reduce the quality of drugs.
Really?
Yes, it does not. So
but that is I will take you up on that very soon. I'll take you up on that.
That's the misconception outside.
I doesn't reduce the quality of
it does not
care,
reduce.
because I know that there are some that will use generic for and they use another. We'll talk about that. Continue. Just continue.
Now, when you subscribe to any health insurance plan or package, it simply means that anytime you fall ill, you can go and see the doctor without paying cash out of your pocket. Because our problem is that when illness will strike, you may not have the money. Not even those of us that are doctors that will keep money aside for ill health. No. If we keep money aside, it's money kept for other things. So it's quite encouraging for people to buy into health insurance scheme. We'll talk more of this, today. So keep watching the physicians. Thank you.